Reduce your risk of the world's #1 killer, cardiovascular disease. Omega-3s reduce your risk of CVD, the world's #1 killer. There are three main types of omega-3. Number one, ALA, found in large amounts in hemp seeds, walnuts, and flax seeds. EPA and DHA are found in cold water fish. EPA and DHA are the forms that reduce your risk of cardiovascular disease. ALA can be converted into EPA and DHA, but unfortunately the process is incredibly inefficient. This is why consuming omega-3 from flaxseed and hemp is not going to give you the health benefits like consuming fatty fish. EPA and DHA has some other absolutely incredible health benefits. Randomized controlled trials show an increase in muscle strength and volume. It also slowed telomere shortening. Telomere length is an indicator of a true biological age or real age. Higher omega-3 intake slows down the shortening of these telomeres. Also improves your memory, in particular with consumption of DHA. Meta-analysis of 17 studies, which in total contained 14,000 people, showed that those with the highest EPA and DHA levels in their blood were 17% less likely to die prematurely and 21% less likely to die from cardiovascular disease in particular, compared with those with the lowest levels. So, what's the mechanism for this? This is explained by the role of omega-3 in blood clotting and relaxation and contracting of arteries. Omega-3 reduces inflammation by reducing the production of inflammatory molecules such as TNF-a, tumor necrosis factor alpha, and interleukin-6, IL-6. This is important as inflammation is a primary driver of cardiovascular disease. This is because inflammation increases the production of LDL, bad cholesterol. LDL promotes formation of plaque molecules, leading to atherosclerosis, which is a thickening and hardening of your arteries, which I'm sure you've all heard of. High triglycerides is a primary component of LDL, which lead to atherosclerosis. Levels of triglycerides above 200 milligrams per deciliter increase the risk of cardiovascular disease. In randomized control studies, 4 grams of EPA reduced triglycerides by 18%, led to a 25% reduction in cardiovascular events. Absolutely incredible. So why should you use supplements, not just get it from your food? 4 grams of EPA DHA versus 1 gram EPA DHA saw greater reduction in cardiovascular events. This shows you need a high dosage of omega-3s that is very hard to consume in high enough quantities from fatty fish and real food. 100 grams of salmon contains 2 grams of EPA DHA total, which means you'd have to have 200 grams of salmon every day to reach 4 grams. This is why using a high quality supplement is advised. When looking to buy a supplement, make sure the omega-3 is in the more bioavailable form, the triglyceride form, which is usually more expensive. Also make sure they're free from heavy metals and not rancid like a lot of cheaper fish oil brands. Cheap fish oil brands also very low dose, having very little EPA and DHA. You'd have to take 30 tabs a day to get your 4 grams of omega-3. Brands I personally recommend are Carlson's, Nordic Naturals, and Trained by JP. All excellent. Trained by JP is pharmaceutical grade, and I know Jordan very, very well, and I know you only use the highest quality ingredients. Per serving contains 4,200 milligrams of EPA DHA total in triglyceride form. With all of our clients, we only recommend the highest quality brands. So in conclusion, omega-3 drastically reduces your risk of cardiovascular disease. You need to consume this from fatty fish or fish oil supplements, as flaxseed is in the inferior ALA form. EPA and DHA reduce your risk of cardiovascular disease by reducing inflammation and triglycerides. 4 grams of EPA DHA total is the most effective dose, and only pick high quality supplements such as Trained by JP, Carlson's, or Nordic Naturals. Want to stay in shape year round and build a physique that truly demands respect, and most of all, feel the best you ever have? Check our website at bodytransformationlondon.com. Look forward to hearing from you.